today on the Frontline Health Podcast.
To me, this is one of the most astounding things that really has happened within the food industry as a whole. When you have other countries and other nations actually shutting down the use of these dyes, yet here in the U.S., we can't do that with our own food supply and our health system. And, you know, the number of issues that has been discovered by red dye number 40, yellow dye number 5, I mean, they're through the roof. And we know that those things have some implications like ADHD. They have things with, mental health. So all those pieces, and we can't seem to do what countries like Canada, just north of us, have been able to do. I have never understood that, and it's something that I think has been bubbling up.
Hello, and welcome back to another episode of the Frontline Health Podcast by Centurion. My name is Evan Patrick, and with me is our founder and CEO, Troy Duell. Today, we are bringing you another episode of Health Headline Highlights, and we've decided to do this just a little bit differently this time. We are going into this blind with each other. So Troy and I have each selected a few health headlines that we found particularly interesting from the past month or so, and we're going to be sharing them with each other for the first time. So we should be interesting.
Ought to be fun. Excited about it. You ready to get started?
Let's get started.
All right. So the first headline I had was cutting sugar in the first 1,000 days of life reduces late adulthood disease risk. Thought it was an incredible headline because it's talking about the importance of just our first 3 years of life, really, and how when we take our sugar intake, as a matter of fact, it says specifically, a low sugar diet in the first 1,000 days of life, which is conception to age 2, can significantly reduce the risk of type 2 diabetes and hypertension in adulthood, lowering the risk by 35% and 20% respectively, and delaying disease onset by several years, which I thought was pretty amazing.
That's so interesting, and it, I guess, places an even greater responsibility on parents. You just think about how much a parent's decisions just impact a child's life, not just in the early years of their life, but throughout the course of their life.
Absolutely, and it's one of those things that I think we've all been in that scenario where the easy thing to do is to get them the ice cream, to get them the cookie, to get them whatever it is, because that's what they want, it's what we want. But understanding that first 2 to 3 years of their life has such a lasting impact, I think is the part that really is amazing. I've heard a lot about how what you do when you're pregnant and when the baby is in the womb of the mother, how much of an impact that has on lifetime. But this is the first time I've seen it where it says the first 3 years outside of the womb had a huge impact on them as well.
I don't know how much you have looked into this, but I wonder how many baby foods there are that are out there that are high in sugar content, because maybe it is easier for parents to feed their babies those kind of foods.
Definitely. There are a lot of cereals that are high in sugar. As a matter of fact, the article goes on to talk about how this could have broader implications for even our policies, because it's going in to regulate those baby foods a little bit more to make sure that the sugar levels are low in those baby foods.
So it's interesting that you bring up cereal and sugar in cereal, because that leads me right into my first health headline that I will share with you.
Nice. Looking forward to it.
Yeah, it also has to do with sugary cereals.
Okay.
So this headline, and again, we did not plan this in advance, so very serendipitous there. My first health headline, Kellogg's faces protests over food dyes in popular breakfast cereals. Hundreds of people gathered outside the WK Kellogg headquarters in Michigan, calling for the company to hold up its promise to remove artificial dyes from its breakfast cereals sold in the U.S. Nearly 10 years ago, Kellogg's, the maker of Fruit Loops and Apple Jacks, committed to removing such additives from its products by 2018. While Kellogg's has done so in other countries, including Canada, which now makes Fruit Loops with natural fruit juice concentrates, the cereals sold in the U.S. still contain both food dyes and a chemical preservative. In the U.S., Fruit Loops ingredients include red dye number 40, yellow dye number 5, yellow dye number 6, and blue dye number 1.
To me, this is one of the most astounding things that really has happened within the food industry as a whole. when you have other countries and other nations actually shutting down the use of these dyes, yet here in the U.S., we can't do that with our own food supply and our health system. And, the number of issues that has been discovered by red dye number 40, yellow dye number 5, they're through the roof. And we know that those things have some implications like ADHD. They have things with, mental health. So all those pieces, and we can't seem to do what countries like Canada, just north of us, have been able to do. I have never understood that, and it's something that I think has been bubbling up. And with this last election, which is interesting, because one of my next articles was RFK Jr. has taken aim at these additives. What could he do as HHS secretary? And the thought behind that was looking at specific things that he was going to look at and really try to take hold of to get our health back under control. And some of those were high fructose corn syrup, seed oils, synthetic food dyes, like you just talked about specifically. He wants to point out the yellow 5, the red 40, the blue 1, because those have been linked to cancers as well. And then, and they're made from petroleum. And then it goes on to talk about how he wants to regulate BHA and BHT, which are used to kind of help baked goods and processed goods that we package stay fresh longer. Potassium bromate, which is put in bread. Then other additives like titanium dioxide, which has been shown to be toxic to our genes and helps produce cancer. So there are a whole bunch of things that I think just that article that you talked about is what may be in the crosshairs of what the incoming Health and Human Services Director of RFK Jr. may be looking at, which is kind of interesting that we both saw those things and ran down that path.
Well, this is very much just in public conversation right now. I know you mentioned a couple of the food dyes specifically that RFK Jr. has talked about targeting and trying to get removed from our foods, and it's a really scary rabbit trail that we could go down. But just briefly, you mentioned some of the things that he could actually do, and I think that's probably what a lot of people are wondering right now is what can the government do, and RFK Jr. specifically in his new position, once this new administration takes office, what can he actually do to fix these problems? And I guess kind of like, what is the root of these problems to begin with? Why do we have these issues in our country when other countries have already kind of begun to solve these problems?
I think a lot of it is just the way that we have such a regulatory base. So our regulation is almost self-regulated. So we have this thing called GRAS, which is, I'm going blank on what it stands for, but it's basically saying that it's safe and won't harm anybody, but it's self-reporting. So the FDA doesn't actually come in and do any studies on red number 40. Instead, if the company says, hey, this is safe and it's not going to harm anybody, then the FDA says, okay, that's fine with us. But hopefully with the kind of this stuff being exposed and more people becoming acquainted with it, we're going to start to shine a light on some of these things that have been reported as safe, but we know in other nations really isn't safe.
Yeah.
And you're hoping that a regulatory board like the FDA can come in and start monitoring that a little bit better and really putting their hand on it and saying, hey, this stuff has to stop. But I think part of that is the regulatory capture that we all feel like is there, where these food companies actually pay the FDA. And when they get done, if you have bureaucrats who come out from the FDA, they end up going and working with these industries and they make a lot of money. So I think there's some of that that's going to have to be stopped. And it may be as simple as, hey, if you've worked for the FDA or you've worked for any other regulating commission, you can't go work for a company that you had influence over while you were in the government. Yeah,
that makes sense, and I think that's true in a lot of different areas. When money is tied into things, things get really, really complicated when people have these ulterior financial incentives
for sure
going on. So it's basically imperative on companies when it comes to food dyes to decide if they if they have knowledge that a food dye is potentially harmful, it's on them to decide if they're going to put them in our products or not. And I know that's something that we here at Centurion have been committed to doing, is to not using artificial food dyes, because they don't do anything except make a product just more visually appealing, which is the reason why a lot of these companies put food dyes. Talked about Kellogg's, in that case, just making the cereal pop a little bit more or look more colorful so that it's more attractive to a kid, and that kid will want to consume it, even though it's not adding anything as far as flavor or nutrients or anything like that.
Yeah, I think part of that is on us as individuals. We've fallen prey and fallen into the trap where we want food to look a certain way, and we want it to be visually appealing. But if we step back and we really start to look at food for what it is, which is to help us have the energy and the health that we need, then maybe we won't fall into that trap near as much. And I think the other thing is understanding that when they use these dyes, they're much cheaper to use those dyes than it is to use some natural dye. So it's a lot cheaper to use the petroleum-based dyes because they make a lot of it. It's typically a waste, so they're trying to find ways to keep the waste down and make it cheap. So unfortunately, that's kind of where we are.
Yeah. All right, so should I share my next health headline?
Please.
On the list?
Yeah.
This is an interesting one. Americans left blind, paralyzed, and with teeth falling out after Ozempic. Now they're suing for millions. When Monica Church was prescribed, that's a problem, isn't it?
That's pretty big, yeah.
When Monica Church was prescribed Ozempic to treat her diabetes in October 2023, she was told it would help ease her symptoms. By Christmas, the 55-year-old woman from Michigan was put in the hospital for 2 weeks because of abdominal pain, vomiting, and stomach paralysis. She lost the ability to eat foods she used to enjoy, like pizza and bread, and now only eats small meals to avoid upsetting her stomach. She said she wasn't told about these side effects by her doctor.
Yeah, I think Ozempic has a lot of issues with it, and more issues seem to be coming out, which is certainly a concern. We have a culture in a society that wants to lose weight, and we want to lose weight by a pill instead of by hard work and effort. And unfortunately, you don't get to be overweight overnight. It's little choices that we make, and at the same time, we're not going to lose that weight overnight by some miraculous pill. And there are times where medicines can certainly help and kind of jumpstart the system for your body, but we don't need to be relying on that. We really need to be relying on the diet and exercise, because I think that's the easiest thing we can do. It's the healthiest thing we can do, and honestly, it's the best thing we can do for our health.
Yeah, so this article I kind of wanted to take with a little bit of a grain of salt, just because it is sort of an anecdotal experience, right? This happened for this lady. And of course, Ozempic is another one of those things that is very much talked about right now. People want to know, is there this magic weight loss pill out there that can help people lose weight? Like you said, people are looking for shortcuts and all kind of different ways. Are there some people, in your opinion, that Ozempic can help, or is it just a thing that across the board we should really try to steer people away from?
I think it's like every medicine. We really need to take some time to look at it, make sure that it fits who we are and what we need, and understand what the true side effects are. The interesting thing that she pointed out is she didn't know that some of those side effects were going to be part of her taking it. But ultimately, that's on her, because we need to start asking those questions when we go to the doctor, or when we start taking a medication. We've put a lot of trust in our medical professionals, which is some deserved, but at the same time, it's our health. Yeah. So her doctor's not at the hospital suffering from those things. Even though he prescribed it, it's her. So we've got to step back and go, what are the downsides of me taking this product, and have those conversations with doctors. I think that's the biggest next step we can take. We see a lot of ads on TV. We see a lot of ads everywhere. Yeah. And I think that influences our desire to take these products. So we need to take a step back. And even though we like the idea of running through flowing fields of flowers that they have on TV, it's not all puppies and roses when you take a product.
running through the field of roses so that all the side effects don't quite strike you in the same way.
That's right.
Yeah.
So you're always seeing the best of them as they're rolling through. It could cause paralyzation, could cause blindness, could cause all that stuff because we typically tune that stuff out at the end of a commercial.
Yeah.
All right. That's a good one. I like that. Here's my next headline. CDC warns of rising mycoplasma pneumonia levels so far this year. So we have seen an increase in mycoplasma pneumonia cases. They reported a significant increase in those infections, particularly affecting young children, with cases peaking in late August, and we're starting them see a further increase now into November. So it has impacted emergency room visits. So we're seeing that rise in the ages 2 to 4, rose to about 7% this year from last year, and a similar increase for kids aged 5 to 17. So again, something like that, we see that increase. What should we do if we start seeing those types of increases out there?
We should pay attention to it.
Should definitely pay attention to it, but start washing your hands. Really start working on just getting as healthy as possible so your body can fend off some of those diseases that come at it.
That's right. Be prepared in advance before something like that happens as much as possible. Yeah, that makes sense. So what is that? What is mycoplasma? Because I've heard of pneumonia generally, but
mycoplasma is basically just the bacteria that is affecting your lungs.
Okay, so it's just a different strain, basically.
Yep.
Okay. All right, and then I'll share my final health headline with you. First wave of COVID-19 increased risk of heart attack, stroke up to 3 years later. An NIH-funded study focused on original virus strain, unvaccinated participants during pandemic. So infection from COVID-19 appeared to significantly increase the risk of heart attack, stroke, and death for up to 3 years among unvaccinated people early in the pandemic when the original SARS-CoV-2 virus strain emerged, according to a National Institutes of Health supported study. The findings among people with or without heart disease confirm previous research showing an associated higher risk of cardiovascular events after a COVID-19 infection, but are the first to suggest the heightened risk might last up to 3 years following initial infection, at least among people infected in the first wave of the pandemic. The study is also the first to show that increased risk of heart attack and stroke in patients with severe COVID-19 may have a genetic component involving blood type. Researchers found that hospitalization for COVID-19 more than doubled the risk of heart attack or stroke among patients with A, B, or AB blood types, but not in patients with O types, which seem to be associated with lower risk of severe COVID-19.
That is a staggering story, and one that I don't think any of us are super surprised at, because you see and you've heard friends, family, whatever it may be, in this long COVID that seems to last for 2 to 3 years, and people are trying to get it out of their system. So that's definitely eye-opening and something to look at, and make sure that if you're out there and you've had COVID, really take care of your heart. Look and make sure that you're not having any symptoms of a heart attack or anything like that, and be prepared. So,
absolutely. Always good advice.
Yes. And then my final one today is not just cholesterol, 4 health myths that persist despite evidence, says Johns Hopkins professor. So Blind Spots is this new book that a Johns Hopkins professor put together, and he was talking about health myths that have been out there, and they argue that their kind of outdated medical practices persist because of us really thinking, hey, this works. Mm-hmm. So he has a thought about groupthink or cognitive dissonance that's going into it. And he said the 4 major health myths include delayed introduction of peanuts for allergy prevention, misconceptions about hormone replacement therapy, antibiotic overuse, and outdated views on dietary cholesterol, which I thought was probably one of the most interesting one. And what his really whole point of the article was, we should have a curious mind when it comes to our health, instead of just taking what the old guard has said about our health or what the historically we've done for our health, and instead start to look at all the more recent research, look at even old research, and say, does this make sense? And really start asking questions instead of just taking people's word for it.
Yeah, and I'd be curious to know how much pushback this Johns Hopkins professor is getting from this research, because I know this is a very touchy thing. Like in the medical community, people can be blacklisted very easily if they're going against the norm and maybe not even making claims, but just asking certain questions because it's seen as threatening. I guess you could say sort of the establishment, and so I'm curious to know if he is experiencing that type of pushback or how that is playing out in his medical career.
It's a great question. I don't know. I never followed up to see, but certainly something we can keep an eye on. His name's Dr. Marty McCary. So you can look him up. You can check it out.
Absolutely. Well, thank you so much for tuning in to another episode of the Frontline Health Podcast by Centurion, where we help you take ownership of your health and life. Troy, do you have anything else to say before we close out?
I don't. So thanks so much for joining us, and hope you join us again soon.